The prostate, although often overlooked in conversations about health, is a vital gland in the male body. Located just below the bladder and in front of the rectum, it surrounds the upper part of the urethra, the tube through which urine is expelled. Its main role is to produce a slightly alkaline fluid that makes up a significant part of semen. This fluid has the vital function of nourishing and protecting sperm during ejaculation, increasing their chances of survival in the acidic environment of the vagina. In other words, even though it is small, the prostate plays a crucial role in male fertility and sexual health. However, what many people don't know is that over the years, especially after the age of 40 or 50, this gland tends to undergo natural changes in its structure and functioning. With the onset of old age, the prostate often begins to grow, a phenomenon called benign prostatic hyperplasia, BPH, which can trigger a number of uncomfortable and persistent symptoms. If you are new here, please like and subscribe to the channel so you don't miss any videos. During youth and early adulthood, the prostate usually maintains a relatively constant size, regulated by a stable hormonal balance. With aging, however, important hormonal changes occur that directly influence this gland. One of the main hormones involved in this process is dihydrotestosterone, DHT, a derivative of testosterone. This substance stimulates prostate cells to multiply, promoting their gradual growth. Over time, this growth can become significant enough to compress the urethra and interfere with urinary flow. It is worth noting that prostate size is not always directly linked to the severity of symptoms. Some men with very enlarged prostates experience little discomfort, while others with moderate enlargement face serious difficulties urinating. Still, the silent progression of this condition is a growing concern among healthcare professionals. The consequences of this prostate growth are mainly manifested through urinary changes. The narrowing of the urethra, caused by pressure from the enlarged prostate, compromises urine flow. This can result in symptoms such as difficulty starting urination, weak or interrupted urine flow, feeling of incomplete bladder emptying, frequent urination, especially at night, and in more advanced cases, episodes of urinary retention, which require immediate medical attention. These symptoms, although initially tolerable, tend to worsen over time and can profoundly impact the quality of life of older men. Sleep is often impaired by the need to get up several times during the night to urinate, leading to fatigue, irritability, and even depression. In addition, constant concern about the possibility of urinary accidents can affect an individual's social and professional life and even their self-esteem. It cannot be ignored that modern lifestyles contribute to the worsening of this condition. Diets high in saturated fats and low in fiber, a sedentary lifestyle, excessive alcohol consumption, smoking, and abdominal obesity are factors that favor prostate growth. The relationship between prostate health and chronic diseases, such as type 2 diabetes, high blood pressure, and metabolic syndrome, is increasingly evident. Men who neglect their health throughout their lives tend to experience more severe symptoms as they age. On the other hand, healthy practices such as regular physical activity, a balanced diet, and stress management have been shown to be effective in both preventing and mitigating prostate enlargement. It is essential to understand that the prostate is not isolated. It is part of an interconnected system where everything that affects the body in general also influences this gland. With aging, regular medical follow-up becomes increasingly important, especially with a urologist. Starting at age 50 or earlier in cases of a family history of prostate cancer, routine exams become essential. One of the main tests is the PSA, prostate-specific antigen test, which measures the amount of this protein in the blood. High PSA levels can indicate inflammation, benign prostate growth, or even early signs of cancer. In addition to PSA, a digital rectal exam remains a simple, quick, and effective test to assess the texture, size, and consistency of the prostate. In many cases, imaging tests, such as ultrasound or more specific studies, such as uroflowmetry, are also requested to measure the strength and amount of urinary flow. Modern medicine has several resources for early diagnosis, and the sooner any changes are detected, the greater the chances of effective and less invasive treatment. However, it is necessary to break the silence and taboo that still surround prostate health. Many men avoid seeking help out of embarrassment, fear, or ignorance. Others believe that urinary symptoms are normal for their age and that there is nothing to be done. This type of thinking can be dangerous, as it delays diagnosis and favors the worsening of conditions that could be easily controlled or even reversed. Getting informed, talking to professionals, paying attention to the body's signals, and taking preventive measures are attitudes that demonstrate maturity and self-care. The body changes over time, but knowledge and conscious action are powerful allies for aging with dignity, health, and autonomy. Among the many factors that affect prostate health, there is one habit in particular that, although common and seemingly harmless, has been increasingly associated with prostate enlargement in men over 50, sedentary lifestyles. This behavior, characterized by little or no regular physical activity, represents a silent threat that slowly creeps into the daily routine. It does not cause immediate pain or acute discomfort and therefore goes unnoticed. However, its consequences accumulate day after day, month after month, directly influencing the functioning of various organs and systems, including the prostate. In a society increasingly dominated by technology, where much of the time is spent sitting, whether in front of the television, at the computer, or driving, the male body is deprived of physiological stimuli essential to its self-regulation, such as constant movement and efficient blood circulation. Due to its anatomical location, the prostate is highly influenced by circulation in the pelvic region. When men remain seated or inactive for long periods of time, there is a decrease in blood flow to the pelvis, which causes fluid stagnation and reduced oxygen in the tissues. This poor circulation, although subtle, causes microinflammation in the prostate, which over time promotes its abnormal growth. In addition, a sedentary lifestyle is strongly linked to the accumulation of visceral fat, the fat that concentrates in the abdominal region and is associated with hormonal imbalances. This fat, far from being simply excess weight, is metabolically active and contributes to the increased conversion of testosterone to estrogen, a process that disrupts the male endocrine system. Increased estrogen levels, combined with decreased free testosterone, have been identified as one of the mechanisms behind benign prostatic hyperplasia. It is important to understand that a sedentary lifestyle is not just the absence of structured physical exercise. It also involves prolonged inactivity during daily tasks. Even men who take a 30-minute walk in the morning but spend the rest of the day sitting in front of the TV or computer are still exposed to the harmful effects of sedentary behavior. Recent studies show that it is the total accumulated time of inactivity throughout the day, not just the presence or absence of brief physical activities, that determines the risk for various chronic diseases, including prostate disorders. Inactivity compromises glucose metabolism, increases insulin levels, and promotes a silent inflammatory state that directly affects the prostate. The human body is designed for constant, light movement, standing up, walking, bending, stretching, using muscles to sustain circulation, breathing, and digestion. When this system is frozen by immobility, degeneration is inevitable. In addition to direct physiological effects, a sedentary lifestyle also indirectly harms prostate health by promoting a number of conditions that are risk factors for hyperplasia. Sedentary men are more prone to obesity, insulin resistance, hypertension, and high cholesterol. All of these factors contribute to the systemic inflammatory process, which affects tissues such as the prostate and accelerates its hypertrophy. At the same time, the absence of physical activity negatively influences immune function, making the body more vulnerable to infections and dysfunctions. Prostatitis, inflammation of the prostate that can be acute or chronic, is also more common among inactive individuals. A feeling of heaviness in the pelvic region, lower back pain, and discomfort when urinating are often linked to this silent condition that develops without the man noticing. And the later he becomes aware of it, the more difficult the reversal process becomes. Changing this scenario does not require radical measures or financial investments. Regular practice of simple exercises, such as daily walks, stretching, and pelvic strengthening exercises, is enough to significantly improve circulation in the prostate region and reduce inflammatory processes. There is solid evidence that physically active men have a lower incidence of prostate growth and fewer urinary symptoms even as they age. In addition, frequent movement improves hormone production, regulates blood glucose levels, reduces oxidative stress, and promotes better tissue oxygenation. It is as if the body itself, by moving, creates the ideal conditions to preserve its natural functions, including prostate function. The pelvic muscles, which support important organs, such as the bladder and the prostate itself, are also strengthened by exercise, preventing discomfort and promoting urinary control. Awareness of this harmful habit needs to be expanded, especially among older men who often do not realize that they are leading a sedentary lifestyle. Some people work standing up all day and are still considered sedentary because they do not engage in any activity that stimulates the cardiovascular system. Similarly, there are retirees who, upon leaving their active routines, plunge into a life of almost continuous rest, alternating between the couch, bed, and armchair as if their bodies were turned off. The transition to old age should be an invitation to movement, to the freedom to use time to take care of oneself, explore new activities, and adopt a routine that respects the body's natural rhythm. When movement becomes part of everyday life, the prostate responds positively, and with it, the entire body begins to function with more balance, vitality, and clarity. Combating a sedentary lifestyle is not just a lifestyle choice, it is one of the most powerful ways to preserve men's health in maturity. When it comes to the prostate, many men immediately think of cancer. However, there is a much more common condition, especially after age 50, which, although not malignant, can profoundly affect quality of life. Benign prostate enlargement, known as benign prostatic hyperplasia (BPH. This growth, often progressive and silent, causes a number of changes in the functioning of the lower urinary tract. These changes may seem minor or temporary at first, a slightly weaker urine stream, a more frequent urge to go to the bathroom, but over time they can become real obstacles in a man's daily routine. The big issue is that many of these symptoms are overlooked or considered natural signs of aging, which delays diagnosis and can lead to serious complications. Knowing these signs is essential to act responsibly and preserve your health. One of the first symptoms noticed by many men is the need to urinate more frequently, especially at night, a condition called nocturia. Getting up once or twice to urinate may seem normal, but when it becomes a routine, interrupting sleep and causing constant tiredness the next day, it is a clear sign that something is wrong with the urinary system. This symptom is directly linked to the bladder's difficulty in emptying completely, due to obstruction caused by the growth of the prostate around the urethra. As urine accumulates incompletely, the body asks to urinate more often, even if the volume is not large. This fragmentation of sleep compromises energy levels, affects mood, and in the long term can lead to stress and irritability. Another very common symptom is difficulty starting urination, known as urinary hesitation. It is that embarrassing moment when a man goes to the bathroom, feels the urge to urinate, but the flow does not start immediately. He has to wait, strain, and sometimes even change position to be able to urinate. This effort, in addition to being uncomfortable, is a clear sign that the channel through which urine passes is being compressed, and the most common cause of this in older men is an enlarged prostate. In many cases, this initial difficulty is accompanied by a weak or interrupted urine stream, which stops several times during urination. This sign is so common that many men do not even realize it is a problem. They simply adapt to urinating more slowly or for longer, without realizing that this reveals an important functional change. There is also a symptom that often causes great discomfort, the feeling of incomplete bladder emptying. The man urinates but feels that there is still urine trapped inside the body. This feeling is extremely uncomfortable, as it gives the constant impression that it is necessary to return to the bathroom. Often, minutes after urinating, a new urge arises, even if the volume eliminated is small. This symptom should not be ignored, as it may indicate that the bladder is working under pressure, trying to compensate for the obstruction created by the prostate. When this pressure is maintained for long periods, the bladder muscle can become thicker, stiffer, and less efficient, which further aggravates the problem. In more advanced cases, this process can lead to acute urinary retention, a medical emergency that requires immediate intervention. In addition to these signs, there are other symptoms that, although less talked about, are also associated with prostate growth. One of them is urinary urgency, that is, the sudden and uncontrollable need to urine. Men feel the urge and need to go to the bathroom immediately, as their ability to control their bladder is reduced. This can lead to embarrassing situations, fear of leaving the house because they don't know if there will be a bathroom nearby, and even episodes of incontinence, especially in cold environments or after consuming diuretic liquids such as coffee or alcohol. Another common but often overlooked symptom is pain or discomfort when urinating, which may indicate not only obstruction but also inflammation associated with prostate growth. This pain can be mild, such as a burning sensation, or more intense, affecting the lower abdomen or perineum, the space between the scrotum and the anus. It is important to note that these symptoms do not all appear at once, nor do they follow a fixed order. Each man may experience different signs with varying intensities. In some cases, prostate growth occurs without any noticeable symptoms for years, while in others, even with a slight increase, the impact on urination is significant. Therefore, relying solely on the absence of discomfort is not a safe way to assess prostate health. Vigilance should be constant, and any change in urinary patterns deserves specialized medical attention. The body speaks, and the way it communicates that something is wrong is not always painful. Sometimes it is just a detail in everyday life that needs to be listened to more carefully. Men, especially in their senior years, need to break away from the idea that it is normal to suffer in silence. Going to the bathroom should not be a feared, uncomfortable, or frustrating act. Urinary health is a direct reflection of prostate health, and neglecting the signs can result in complications that could have been avoided with a simple conversation with a urologist. Ignoring symptoms does not make them go away. It only allows them to progress silently. Having the courage to investigate, seek diagnosis, and take care of yourself is actually a gesture of respect for yourself, your life, and the people with whom you share your daily life. Preventing prostate growth is a task that requires ongoing attention, especially after middle age. Contrary to what many people believe, prostate enlargement is not an inevitable fate for older men, but rather the result of a combination of factors, some genetic, others environmental, and many related to lifestyle. When men understand that their daily choices directly influence the health of this small but important gland, they have the power to prevent or significantly delay the onset of benign prostatic hyperplasia. Prevention begins long before symptoms appear. It is built into daily life, eating habits, attitude toward one's own body, and willingness to adopt practices that promote balance in the body as a whole. One of the main allies in preventing prostate growth is a conscious and balanced diet. Studies have shown that diets rich in vegetables, fresh fruits, legumes, whole grains, and healthy fats are associated with a lower risk of prostate problems. Antioxidant foods such as cooked tomatoes, rich in lycopene, broccoli, cauliflower, carrots, pumpkin, watermelon, and red fruits help fight free radicals and reduce silent inflammation that, over time, can contribute to prostate enlargement. Similarly, it is important to reduce consumption of red meat and ultra-processed foods, which are high in sodium and saturated fat, as these promote the accumulation of visceral fat and impair male hormone metabolism. A balanced intake of zinc, selenium, and vitamin D is also essential, as these micronutrients play a direct role in prostate function and immune system regulation. Another essential pillar of prevention is regular physical activity. Activities such as walking, swimming, light cycling, and even gardening or dancing may seem simple, but they have a profound effect on the health of the urinary system. Aerobic exercise stimulates blood circulation, reduces systemic inflammation, and helps balance hormones that, when in excess or deficient, can negatively affect the prostate. In addition, strengthening the pelvic region through specific exercises such as Kegel exercises improves muscle tone around the bladder and urethra, preventing urinary incontinence. You don't have to be an athlete or go to the gym. The important thing is to keep your body active on a consistent basis. Regular movement is more effective than sporadic intensity. When the body moves, the prostate benefits from a healthier, more oxygenated, and stable physiological environment. Another often overlooked factor is the impact of chronic stress and emotional state on prostate health. Constant emotional tension, untreated anxiety, repressed anger, and prolonged mental fatigue activate hormonal responses that silently inflame the body. Stress releases excess cortisol, a hormone that interferes with testosterone production and can directly affect prostate tissue. Practices such as meditation, deep breathing, recreational activities, positive social interaction, and leisure time should be incorporated into your routine with the same degree of importance as diet and exercise. Mental and emotional health is a determining factor in the balance of the entire endocrine system, and this balance, in turn, is essential for the prevention of prostate growth. Adequate hydration is also a crucial part of this preventive care. Drinking enough water throughout the day, not just when you feel thirsty, ensures proper kidney function, helps eliminate toxins, and keeps urine diluted, which reduces the risk of urinary tract infections and irritation. Concentrated urine caused by low fluid intake can irritate the bladder and urethra, preventing the bladder from emptying completely and overloading the prostate. Older men in particular tend to reduce their water intake for fear of incontinence or needing to urinate frequently, but this practice can actually worsen symptoms in the long term. Proper guidance from a professional can help establish a healthy fluid intake pattern that respects comfort and preserves urinary health. In addition to physical and behavioral care, regular medical monitoring is an indispensable part of prevention. Seeing a urologist at least once a year after age 50, or earlier if there is a family history, can identify prostate changes at an early stage. A digital rectal exam combined with a PSA blood test are simple but powerful tools for detecting early abnormalities. Early detection is the key to less invasive interventions and greater control over the progression of conditions such as prostatic hyperplasia. Many men resist these consultations out of embarrassment, misinformation, or unfounded fears, but overcoming these barriers is an act of maturity and self-care. Taking care of the prostate in old age is not an isolated gesture, but part of a broader vision of integrated health. It means looking at the body as a system where every choice, from what you put on your plate to how you breathe to how you deal with your emotions, has an impact on all organs, including those we don't always remember in our daily lives. Men who walk, eat well, sleep well, smile, talk, and listen to themselves are, even without realizing it, cultivating an internal environment in which the prostate has fewer reasons to become diseased. And when prevention becomes a habit, health is no longer a distant goal, but a constant presence in everyday life. Taking care of prostate health does not necessarily mean relying solely on medications or invasive procedures. Over the past few years, several natural approaches have been gaining ground among both healthcare professionals and patients themselves, especially those who wish to prevent or alleviate the symptoms of prostate enlargement in a more balanced and less aggressive way. When properly guided, natural medicine does not replace conventional medical treatments in cases where there is a clear clinical need, but it can be a powerful ally in maintaining prostate function and reducing the discomfort associated with hyperplasia. The key to this care lies in understanding that nature offers a range of substances with anti-inflammatory, antioxidant, mild hormonal, and toning effects that, when used consciously, promote prostate health and overall well-being. Among the most studied and used natural treatments is saw palmetto or Serenoa repens, a plant native to North America whose fruits have been used for centuries by native peoples to treat urinary and reproductive problems. The lipid extract of saw palmetto acts directly on the prostate's hormonal metabolism, inhibiting the enzyme 5-alpha reductase, responsible for converting testosterone into dihydrotestosterone (DHT), a hormone that in excess stimulates the growth of the prostate gland. Several clinical studies show that continuous use of saw palmetto can significantly reduce symptoms such as weak urine flow, the need to urinate at night, and the feeling of incomplete bladder emptying, with much milder side effects than synthetic drugs with similar action. It is an especially valuable alternative for men in the early stages of hyperplasia who wish to intervene preventively or complementarily. Another widely used natural resource is net, particularly the species Urtica dioica. Its roots contain bioactive compounds that help modulate the inflammatory response in prostate tissue and positively influence hormone metabolism. Like saw palmetto, nettle has shown good results in reducing moderate to mild urinary symptoms. The two extracts are often combined in specific supplements, creating a synergistic action that benefits not only the prostate but the entire urinary tract. In addition to its anti-inflammatory properties, nettle also helps strengthen the immune system and reduce joint pain, which is highly valued by older men who often face multiple health challenges simultaneously. Pumpkin seed oil, in turn, is a rich source of essential fatty acids and phytosterols, substances that help regulate cholesterol and protect prostate cells against oxidative and inflammatory processes. Its continued use can help maintain the gland at a healthy size, reduce urinary urgency, and improve urine flow. In addition, pumpkin oil is also known to promote bladder health by preventing irritation and strengthening its muscles. For many men, the simple habit of including this oil in their daily diet, either in capsules or in liquid form in salads, represents a significant step toward a more conscious personal care routine. The same can be said for eating whole foods rich in zinc, such as sunflower seeds, Brazil nuts, and oats, as zinc is an essential mineral for prostate function and is often deficient in many older adults. In addition to medicinal plants and specific nutrients, natural practices such as personalized herbal medicine, acupuncture, and the use of medicinal teas have also shown good results when combined with professional supervision. Acupuncture, for example, has been used successfully to relieve urinary discomfort, improve circulation in the pelvic region, and balance the body's energy flows. Horsetail, stonebreaker, elderberry, and dandelion teas are traditionally used to cleanse the urinary tract, stimulate the elimination of toxins, and reduce mild inflammation, creating an environment less conducive to prostate growth. It is important to note that, although natural, these herbs should not be used indiscriminately. Each body reacts differently, and it is essential to respect dosages, cycles of use, and possible contraindications, especially when already taking prescribed medications. Paying attention to the mind and emotional state is also part of this natural prostate care. Techniques such as guided meditation, deep breathing, yoga, and Tai Chi Chuan help reduce blood levels of cortisol and adrenaline, hormones linked to chronic stress that, when in excess, promote silent inflammatory processes. When men slow down, breathe mindfully, and cultivate moments of stillness, the entire body responds with greater balance, and the prostate is no exception. When treated well, the body has an amazing capacity for self-regulation, as long as its natural needs are respected. Being attentive to your own rhythm, diet, sleep, and emotional well-being is as therapeutic as any capsule or supplement. These natural solutions, while not as immediate as synthetic medicine, offer a deeper and more sustainable path to wellness. They require consistency, listening to your body, and a commitment to your own well-being. But in return, they provide not only relief from symptoms, but also an overall strengthening of men's health. It is an approach that values prevention, balance, and respect for the body's natural physiology, something especially important in old age when the body no longer tolerates excesses and responds better to lightness, rhythm, and nature.